Hi, I'm Dr. Mark McCawley, and I'm going to answer some questions about do these cases last? So everybody says, okay, all right, you can make it better for a little while, but does it stick around? You know, once an implant goes bad, you can rehabilitate it, but it's going to come back, right? Well, that's not the case. So here's a case that I treated back in 2017. So again, this implant had bone up to there, lost a bunch of bone. We ended up seeing this patient in 2017 for treatment. We were actually able to treat this patient. And here they are, a couple months ago, we were actually able to regenerate the bone. And well, we kept it there for 7 years. So actually almost 8 years. So that is something that's really, really nice to be able to show right there, because once that implant starts to lose bone, we are actually able to regenerate the bone, and not only regenerate it, we're actually able to keep it regenerated for a long period of time here. So if he keeps this clean, he can keep that implant indefinitely. So as long as you keep it clean, you can keep them. If you have any implants that are going downhill, especially if they've been in your mouth for a long time, the longer they're in the mouth, the more likely you are to have bone loss on them. So it would be good to come in, get checked out, because we can definitely help you out, and we can help you out for a very long period of time, and we can help you keep that implant. So thank you very much, and have a great day.